aides at medical appointments.
Knock, knock.
Some people with disabilities have aides who help with transportation and personal care. Doctors and staff at the medical office sometimes assume that an aide is a family member or guardian, or that a patient who is accompanied by an aide is nonverbal or has an intellectual disability. This is a true story about Nikki's experience at a doctor's office, as told to her service coordinator.
Well, I'm in a bad mood today.
Why is that?
Because I tried to go to the doctor's this morning and I couldn't do it because the doctor was talking to my staff instead of me. It was a new doctor because mine retired.
Oh, so you met with a new doctor and Sue was with you?
Yeah, but the doctor just came in and took over like I was nonverbal, and that doesn't work for me because I am verbal. I told him I was right there, but he didn't listen to me. So I'm stuck. I need some help in learning ways that I can stand up for myself because I'm not going to continue to keep going back to that doctor if he's not going to listen to me.
So maybe we need to do two things. We need to work on your reaction so that you don't get so upset. We also need to talk to your aides, and maybe your aides need to tell them that they are there only for the purpose of transporting you, and they need to make it really clear.
Nikki and her service coordinator have identified a common barrier to speaking up at the doctor's office. People make assumptions about Nikki's ability to communicate because she's accompanied by an aide. It is important for medical professionals to first greet the patient. Second, ask the patient to introduce their aides. Third, clarify the role of the aide at the medical visit. And lastly, ask the patient whether their aide should stay in the room for the physical exam.
And maybe we need to do some role play for the next time.
Hey,
Hi.
how you doing, Sue? How did Nikki's appointment go today?
Excuse me, I'm right here.
I'm sorry, Nikki. How are you? Sue, how did Nikki's appointment go today?
How'd your appointment go today, Nick?
Bye.
Oh, okay. Didn't you have a doctor's appointment?
Yeah,
Okay. And it went well?
I got the okay to go back to water therapy today.
Oh, okay.
Well, geez, Nikki, I'm really sorry that I didn't talk to you first. I really apologize for that. So,
That's okay.
I'll
just-
try to work on that in the future, okay?
That's okay.
Okay.
Practicing what you will say and role-playing are strategies patients can use to become more comfortable about speaking up at the doctor's office.